The programme's trying to meet the changing needs in community healthcare. It's changed hugely over the last 20 years. Patients are more complex. If you're over 65, you're more likely to have 3 long-term conditions than 1. And most of the workforce haven't had the opportunity to learn how to look after people who are frail and complex. So the intention of the programme was to really meet the needs of that increase in knowledge that's required, whilst also doing some joint learning with different therapists. So we didn't want it to just be for registered nurses, we wanted it to be across the board for all our clinical workers.
Yeah, so the development of the programme really goes back to almost pre-COVID really. The main development happened during COVID, but the journey began pre-COVID when we started doing quite a detailed skills analysis to look at where the gaps were in clinicians' knowledge and skills, and also in terms of their confidence, because obviously that's key, particularly where you've got staff working in community settings where they're often working in a solitary environment. So confidence is a really important way of being able to use the skills and the knowledge that they have.
As far as we're aware, nowhere else in the country is doing something this robust, because what we're trying to do is also take the pressure off the practice by not having everybody out of their clinical area for too long. So it's basically 5 talk days, the rest of the work is done in place. So the clinical facilitators are out coaching individually, because we know that's where the quality learning takes place with the patient. So it's lovely to have that recognised.
Yeah, so we were really grateful to Lucy Clement, who's the Associate Director of Community Nursing, to encourage us to apply, because one of our main aims in applying was to be able to increase awareness of this as a programme which is highly transferable and it could be very easily picked up by a range of organisations, including health and social care, voluntary and community sectors. I mean, its potential is huge, and I think we really wanted to have the opportunity to be able to share that on a national sort of programme.